Welcome back to County Connection. For our final segment, we're back with Jen McAtamney from Building Hope. Welcome back, Jen.
Thank you.
We're going to talk about new mental health programs available in Summit County thanks to our local voters. So, Jen, Summit County voters made a big statement in November of 2018 about the importance of mental health services and programs. Can you tell us what happened?
Yeah, so it was really exciting. I mean, I think it's really incredible that our local government, through the BOCC, made the decision to put what were really the top issues that they hear again and again from the voters onto the ballot for the community to weigh in on if we should be doing something as a community and taxing ourselves more to put more funds towards that. So on, I think it was November 6th, overwhelmingly, our voters supported 1A, which we called, even during the campaign, Strong Future for Summit County. And that combined universal pre-K or a really strong pre-K program, recycling, wildfire, capital, and in my world, mental health. So that generates a little over on the mental health side, a little over $2 million on an annual basis that is going to go directly into the community for mental health. A little bit of that money does come to Building Hope in order to cover our operations, to make sure that we're there to be the convener for the community. And what's super exciting, like I was said in the last segment, we had done a lot of work with the community, both stakeholders and really evidence-based, looking at what was available and prioritize a number of items over the next couple of years that we'll be going out with.
Great.
The very first one that we did was mental health navigation. And for those of you who are unfamiliar with that, that's basically, if you're familiar with the healthcare navigator that they have at FERC, it's basically the same thing, but it's around mental health. So if you have co-occurring things like you have depression and a substance use issue, this is someone that you can work with, which will help like literally sit with you, connect you with the resources, help you follow up, make sure that you're getting the care that you need. So right now, through a grant, we've been offering that at FERC, and the first RFP that we put out was for mental health navigation, and the decision was made for that, and the recommendation was that FERC was one of the people who applied for that. So they have, I know the BOCC approved that last week. So they're working with contract. So that will put, in the next 60 days, we'll put 3 full-time mental health navigators into our community.
That's awesome.
It is really awesome. And one of the things that those people do, in addition to helping people, we have something called the Daily Huddle. And so connecting with the care clinic, now the mental health navigator in the jail, with Building Hope navigators, with the care clinic, with the hospital, they talk on a daily basis to make sure that patients aren't falling through cracks, or if they're missing an appointment here, where are they, who can follow up with them, someone is having a hard time getting medication, how can they help them? Has really brought the idea of coordinated care to a whole nother level in our community.
Right, and if you are seeking services, sometimes, whether it's physical health or mental health, without kind of that support system, sometimes it can be easy to slip through the cracks and kind of get lost in processes.
Well, I know even our family, I feel like I've been here in the community for like 20 years. We're really well connected. I've been very active on a whole bunch of levels, and one of our daughters had a mental health crisis, and I found how difficult it was for someone like me. So I know personally that this is something that the community really needs. If I had been able to call Rachel over at FERC and been able to figure out a way to be able to help her in a better way, it would have been so much easier for our family. So we really hope that we provide that same service for all families and individuals. Whether you're a family of 1 or a family of 7, we want to make sure that you have access to those resources and someone to hold your hand through that really hard time.
Right.
It's really incredible how much care they have. Our navigators are bilingual also, so they can help people whether they're English or Spanish speakers. If you have other language issues, we have translation services that we can use. These services are completely free.
Awesome.
And so it really is being delivered to people when they need it. You can access those, like I said, at FERC We have mental health navigators there on staff, and now they'll be continuing and they'll be funded going
Fantastic.
forward. The next thing that we're rolling out, though, is one of the things that was identified, and I'm sure lots of people know, but through our school-based health programs, one of the most highly utilized service, and actually where we don't have enough capacity, is in therapy for kids who are in schools.
Right.
It's super, not only is therapy expensive, right?
Absolutely.
Most of the therapists here in the community don't take insurance, but through school-based health they would, or they can get a Building Hope scholarship through that so that they can access therapy for free. But the good news is through this next RFP, we will be upping the therapeutic capacity at all of our schools to make sure that is so awesome that a child who is in school doesn't have to be picked up, brought somewhere else. They can just pop out of class, go to their session, get the help that they need. Plus, really, when we did this RFP, we were really looking at that bigger framework around mental health and our youth, and so that RFP asked the next vendor to address things at a universal level for all kids. It could be things like mental health screenings for all children, and really providing framework so as the level of acuity goes up, that make sure that those kids are serviced in the schools, to make sure that if a child does have to go and be hospitalized for a period of time, that we have a good transition plan for reintegrating them back into school. So, I mean, these are incredible things. These are the stuff that, it's this, the stuff of legend that communities want to be able to do for their children, and that's what is going to be happening here. So we're looking, that will roll out for the next school year.
Right, that's great. And I think that that program is just so important in Summit County, where we have such an insane percentage of households where both parents work, and just there are logistical barriers, legitimate logistical barriers of, if you did have to take time off of work once a week to grab your kid from school and bring him or her to
therapy,
right? Yeah, and then back, and
it can be very time consuming, and it can be really disruptive to their jobs. Not all employers are sympathetic for families managing those kind of needs. So the school-based health system, I discovered it a number of years ago and used it always for my kids' physicals. So they would just leave class, they could go have their sports physical, pop back into class. Same thing for therapy, and which is so nice. And they can also work with the school counselors when there's behavior issues to make sure that the school counselors are aware, that the teachers are aware what is going on with that family, and give them tips and tools for managing that behavior in the classroom. So these are this is the kind of stuff, like I said, it's the stuff of legends, the things that we want to be practicing. Right. And because of the voters here, we're going to have the resources to be able to deliver that.
Awesome.
So
what other programs are part of the Strong Future package?
So the next things that are on our list is the co-responder model. So this is working with the sheriff's office. The idea is when someone is in crisis, they would call 911, but instead of showing up in uniform with an ambulance, which once again can really take a situation that's stressful and amp it up and amplify it, right? Yeah. Because now the neighbors all know, everyone's wondering what's going on. And just the police, even though they have some training, they're really not mental health specialists. Right. So the co-responder model would have a therapist or a crisis therapist, someone who could do that evaluation, work with that individual who's in a rough spot. They would arrive in plain clothes, in a plain car. You might not be able to tell who is the officer from a protective standpoint, and be able to work to de-escalate the situation. So this is a model that's being practiced very successfully in Picken County, as well as Douglas County, and they've seen less hospitalizations around it. People don't end up in the emergency room, which once again exacerbates the crisis. I mean,
and may not even be appropriate for care.
Well, because the emergency room doesn't heal your brain.
Right.
They're good at stitching you up and making sure, but and not only that, but you're there and you end up with a big bill.
Right.
So we really, we always encourage people, if they are in crisis, that they should be using the state hotline, and that through that they will dispatch mobile response. But we've been working with the sheriff to develop this next model, which will be really exciting. And the thing we're looking at really seriously is what's called a tiered model, so that in a lower level crisis, it might just be the therapist that responds, right? And then as something would escalate and you need law enforcement there just for protection, then an officer would go with. So basically making sure that we're meeting people where they are with the needs that they have at that moment, making sure everyone's safe and doing it in the best way possible.
Great.
Yeah.
Let's see. Are there other pieces?
Yes, there are. There's more. I mean, the list goes on, Julie. The good thing is that we have some money to address this. The sad thing is it still won't be enough to do everything. But the thing after that we'll be looking at is one thing that we know that we have very high substance use here in the community, right? We're the binge drinking capital of the state in Breckenridge. And so we will be looking at what's called intensive outpatient program for substance use. So when people leave treatment or sort of are in between, this is like multiple touch points in the week, every week with therapy, with nutritionists, that kind of stuff. So that is a really big program. It's a really big project. We know that we need to be really deliberate and thoughtful about what that looks like. And so right now we're working with the experts at Mental Health Colorado to really develop and flesh that out about what we want it to look like and how it's going to interface with the other resources that we have in the community. So that'll be coming out later in the fall. After that, more public education. Peer support is a big one, so I talked about that a little bit before. That's not necessarily a licensed counselor, but it's someone who's a trained peer to support you, to listen to you, right? To help you through the rough spots, hold your hand when things get rough.
Right.
So, I mean, those are all the things that are on tap. We're always looking. The sheriff is amazing. He actually wrote a grant to the state. We're hoping to find out more soon about the co-responder model. And so if he gets that grant, we'll probably shuffle priorities around a little bit and see how that rolls out. But we're so excited to be doing this work and really getting those services out to the community.
Absolutely.
Because we just know that the bigger safety net we have, that the better off we'll be.
Right. And one of the things that strikes me about this kind of menu of programs is that there is that interconnection between and among a lot of them, and the way that we ensure continuity for folks and just make the process easier and make sure that the right people are talking to the right people.
Yeah, I mean, really, it is, it needs to be a continuum of care, and that's what we're doing is filling those gaps. So right now, currently we have therapeutic resources, but a lot of people can't access them because I said private therapists don't take insurance. So Building Hope invented our scholarship program. We hear time and time again how isolating our community can be. So we've created connecting events, which I think are amazing. And the fact that we're deliberate enough to say we're going to do trauma-informed yoga. We're going to make sure our yoga instructors and our sound healing people have this level of training. We're going to do things. We had a wonderful connecting event a couple weeks ago with the Blue River Horse rescue up and so things like that about how horses can help with therapy and connecting people to that everything. I mean, you see it with young autistic children, so the same thing can help people at other ends of the spectrum. So we have those things. We have mental health navigation, which then can help people, find the resources. And then, like I said, we'll have things so when people are coming back into the community to support them, because we don't have a full-blown treatment facility here. Right. So how do we support them when we come back? How do we make sure that they stay? We also have a very cool, recently, the Denver Women's Center opened a intensive outpatient program over in Dillon. So they are now taking women who have substance use issues and helping them move through that next part of their recovery.
Great.
So, yeah,
very cool.
It's really, really exciting. And then down the road, we also will be looking at some support for severe and persistently mentally ill. So think bipolar, think people who are psychotic. We have, people in our community like that. Just make sure that they have the resources that they need and the programs that they need so that they can have a really functional and full life. I mean, to me, the best thing about mental health, not only do we need to destigmatize it, but we also need to remind people that there are really good outcomes when you get the help that you need.
Right. It doesn't always need to feel like this.
It doesn't always need to feel like that. And then for people who aren't, we want to really arm everyone in the community with things like QPR, which is, it's basically CPR for suicide. The idea is, it's called Question, Persuade, and Refer, and it's a 1 hour training class that you can go through. First of all, it debunks all the myths that you think of suicide.
Okay.
And really kind of creates clarity around that most suicides are preventable if just the right intervention happens. And so we basically prepare people with the right language, make sure that they're not afraid to ask, are you going to hurt yourself? Are you suicidal? Those are really important questions. Mm-hmm. But the idea is, just like with CPR, if we train thousands of people with QPR, that we will be able to intervene, and people will have the skills out there so that they can help their friends and family and coworkers. Then we also had, as I said, mental health navigation training. So like companies out there, please call us at Building Hope. My email is jen@buildinghopesummit.org. We're happy to arrange to do these mental health navigation trainings. They're only an hour, and we bring snacks.
Awesome.
And then we have,
how can you say no to that?
How can you say no to that? Yeah, we have mental health first aid trainings that are on our calendar under our connecting events as well. That's a full day class, but it really gives you a whole bunch of information and knowledge to help the people around you around mental health issues. So it's a big topic.
Yeah.
But the more we're willing to talk about it and be honest about it and just realize it's just another health issue, the better off we'll all be.
Right. And we have some big resources that are hitting the ground, have already hit the ground, and that are just really great to see here in Summit County.
It's really incredible. I think that, we've taken such an innovative approach by partnering with nonprofits to get those funds out into the communities. As a nonprofit, we can be a little bit more nimble. We can do things like work with organizations like Mental Health Colorado and bring in those experts. And it's really, it's the thing that we're focusing on, so we can really provide the expertise on behalf of the community. So thanks.
Fantastic. So Jen, if people are interested in learning more and diving deeper into any of these programs or accessing them, how can they get in touch with you?
Yeah, so our website, buildinghopesummit.org. You can find all kinds of information. We have mental health screenings that you can take anonymously to find out maybe if you do need therapy or if you are experiencing depression. We have our therapist database on there. So under resources, you'll see therapists. We have our connecting events. So once again, free, wonderful events to meet other people in the community, have an opportunity to do some art, practice some yoga, and learn things. A broad range of things, just depends on what's on the calendar that month. Uh-huh. We have our scholarship program, of course. And like I said, my email address is jen@buildinghopesummit.org. Our phone number is 970-485-6871.
All right. Thanks, Jen, for coming in and sharing all this great information with us. And thanks also for all of the hard work that you and your team are doing at Building Hope.
We have an incredible team who are putting their heart into it every day.
Great.
So thanks.
Thank you. And thanks to those of you who have joined us for another episode of County Connection. We'll look forward to seeing you next month.